Dr. Joe Congeni with us. He joins us most Wednesdays at this time. Good information, sports medicine, and really great stuff to talk about and look for in our kids. And a lot of us in our families listening this morning have young athletes, and he gives us a good perspective. Where'd you want to talk about today, Joe?
A couple things that I think are going to affect our beloved Cleveland sports teams. And so starting with an Indian point that's happened in the last week, Ray. And so the real only question for you, and of course you know this, who in the on the Cleveland Indians organization, who is the most important Cleveland Indian person? Who do you think?
Terry Francona.
Tito Francona. Very good. You never would have a problem with that. I mean, of course, Frankie's great. We got a couple more years. But Tito, 6 years, making the playoffs every unbelievable.
And what he's done
does
with this team this year,
he
better be manager of the year.
Yeah, they're getting sick of giving it to him. But, he missed a game last week. We lost that game. And it was a thing that many adults get, but even some athletes get, and it was a tear of the retina. And so the retina in the eye, he had eye and then minor eye surgery. And I just want to let people know, this is something many people, and you're in my age range, get from the retina wearing out a little bit. But athletes get it from trauma sometimes, too. So what happens is tear in the retina can become totally detached, and the symptoms that people are going to get is usually it starts with a flash of light and then floaters that people can't get rid of. And so those are symptoms. Hey, I better check out with an eye doctor and get in here fairly quickly. And then one thing that's more emergent, get in that day, is if you start getting what's called the proverbial curtain, the gray or black curtain, which limits the amount of motion. The field of vision that people have. And so Tito relayed that he'd had a couple of weeks of symptoms. He got in, hopefully early. If it's still a tear, they usually can fix it through laser surgery, which is short term, and people are back to their normal routines within a day or two. If it's torn completely and detached, there's a much bigger surgery that can be 2 to 4 weeks minimum, and so it can become a bigger deal. So it's something that does occur in healthy adults, but it occurs in our athletes a lot due to trauma. And in a career of being on the sidelines, I've had 2 of them that I've seen in high school athletes. So if they're complaining of funny symptoms, floaters, flashing lights, and ultimately this curtain closing in their field of vision, get them in to be seen by, I know in one case we were on the sidelines out of town, get to an emergency room. So that was number one. Just Tito's our guy. He's our ace in the hole. Yeah. We need him. Number 2, a Cleveland Brown point, and we've talked about the fact, just because we're fans too and love it, the Browns kind of have some pressure to get off to a fast start. And our old friend, who we know well from Walsh Jesuit and Stowe, and the head coach of the Tennessee Titans, that's a big game one. Mike Vrabel will be bringing his team in here. And, it's going to be tough. You got to get off to a good start. But one thing that's been a little in our favor that came out in the last week or two is their all-NFL left tackle, a guy by the name of Taylor Lewan, looks like he's going to be suspended for the first 4 weeks of the season. So I don't know if you saw that point.
I did.
Yeah. And so he's the old Michigan tackle. He was awesome at Michigan. He's been great in the pros. He's really looking to be the kind of guy that's a multi-year all-pro, kind of like a Joe Thomas type for their offensive line. Usually in the NFL, precedent is they're suspended for 4 games. There's no doubt about it, because if they catch what they have, the illegal substance, even if you appeal it. So he is appealing it. Just the luck of a Cleveland sports team, they'd probably say, hey, week 1, go ahead and play, and then we'll start your suspension. But supposedly right now it looks like they're preparing, despite the appeal, for 4 weeks out, and that would mean he'd miss the Brown. Wow, they'd have to shuffle their line with Myles Garrett. Could be a little advantage for us. We'd like it. But anyway, I wanted to talk about the steroid he was using. It's a newer one. And so we've talked for a long time about, at the pro level and high college level, these are high stakes. So there's people designing steroids that cannot be as detectable. And he was using one of these newer non-detectable steroids. The name of it is called Osterine. And it is starting to show up in some of the supplements that even some of our younger kids. You got to look for that. If you're using this supplement, this is the number 1 supplement that's causing people to have positive drug tests and be suspended for long periods of time in the NFL, even some of the high school kids. kids. The type of steroid it is, I don't want to get too technical, but the name of it is a SARM, S-A-R-M, Selective Androgen Receptor Modulator. So the selective part means they're trying to reduce that androgen part of it so it's harder to pick up. And so it's not going to be as easily picked up in the drug test. Well, obviously that didn't help Taylor Lewan. It was picked up. The problem, it's really apparently a great designer steroid. It combats muscle wasting. So what do you want during the beginning of a season? Something that's going to keep you from not breaking down the muscles, but it's also good for bulking up muscles in the off season. So it's a pretty powerful steroid that works on both ends of preventing the tear down and helping the build up. And so it's one that, of course, people are trying to get their hands on, but it has a really bad side effect profile. Pretty significant liver damage, blood clots, heart attacks. So, of course, we're trying to keep people safe, and if we can pick up these SARMs, these newer type of steroids, pick them up earlier on. Now, you mentioned there is some testing in the high school, and I told you I'm gathering some information. We'll talk more about that because there are a lot more high schools testing. But in the college setting, definitely testing goes on. We're involved at the University of Akron for their testing and at Walsh University. And in the pros, a lot more testing. So we may be hearing about some of these newer steroids. Pretty powerful, pretty helpful. But as you try to cross over, and as some people are going to get clipped and caught, and we hear every year of a handful of NFL players, and it happens right away in week one, probably one of the Titans' best players looks like he's going to have to sit that week out.
Good stuff, Joe. Thanks for coming in.
Okay, have a great week.
You too. Dr. Joe Congeni from Akron Children's Hospital Sports Medicine Center.